Good afternoon, good evening, and good morning, everyone. Thank you for joining us and welcome. It is a pleasure to introduce to you our new event within the World Antimicrobial Awareness Week events developed by FIP. So today we are going to discuss the crisis of a resistance, non-prescription antimicrobials as frontline tools in the combat against AMR. Next slide, please. My name is Dalal. I am a pharmacist and a microbiologist speaking to you right now from Doha. I work at the Qatar University Health Sector, and I am a member of the Antimicrobial Resistance Commission of FIP. So it's a pleasure to join all of our attendees today, as well as our esteemed guests, to deliver to you this event. I would like, before we start, to share with you some housekeeping announcements we usually share in FIP digital events. So please note that this webinar is being recorded and it is also live streamed via YouTube. If you would like to access the recording later, it will be available on the events website of FIP, www.events.fip.org, so you can access it from there. Please note that we do have a Q&A tool in the meeting, and you may ask questions in the question box provided so that our speakers can answer you after the webinar, after the presentations are done. Also, if you would like to share with us your feedback, you are welcome to do so using the email webinars@fip.org. We would invite you also to benefit from the different benefits as individual members of FIP if you want to visit the FIP.org membership and register yourself as a member of our community. If you are not an English language native speaker, please note that translation feature is available on Zoom in this meeting. So you need to do the 3 steps outlined here. Turn on the captions, enable the translation toggle, choose your preferred language under My Caption Language from the box, and now you can follow along with the captions that will be live translated right away from the webinar. Please note that due to the importance of AMR, FIP has hosted several awareness events during the World Antimicrobial Awareness Week. So after the previous events, and they were really successful, we are happy today to share with you our 5th and last event. And we will end the event by recapping this webinar with our key messages. If you have missed the previous events and you would like to have an idea of our discussions that went off before, please do scan this barcode so that you will be able to watch any of the recordings of the 4 events that addressed different topics and which were delivered by our speakers from different areas of the world, different expertise, and different perspectives on AMR. For the current webinar today, the learning objectives intended by the end of this webinar is to explain to you strategies to reduce infection burden and prevent antibiotic misuse, including the role of responsible self-care by individuals. We will also tackle and identify key principles for ensuring quality, safety, and appropriate use of non-prescription antimicrobials in the communities where this non-prescription use is possible. We will also recognize the importance of cross-sector collaborations to advance the efforts for mitigation of AMR. After this brief introduction, we will welcome our guest speakers for today, and then we will listen to the first presentation, Reducing Infection Burden and Limiting Antibiotic Misuse. The second presentation will be focused on ensuring quality non-prescription antimicrobials and driving public awareness. Then the third presentation will be Advancing Awareness and Responsible Antimicrobial Use. After our 3 speakers will deliver those presentations, we will take the time to answer your questions, and then we will close this session with our concluding remarks. So it is my pleasure to introduce today's speakers for the event. Over the next maybe hour and a half, we will be having Greg from Switzerland, Jane from South Africa, and Edwin from UK. I will be talking more about our speakers just before their presentations, but I'd like to thank them for offering us the opportunity to be with us today and deliver their valuable insights to our audience. So thank you, Greg, Jane, and Edwin. It is really a pleasure to have you today. I'd like to highlight for our audience also that this event is focused on three primary FIP development goals that directly tackle AMR. Primary Development Goal 17, which focuses on antimicrobial stewardship, Development Goal 16, communicable diseases, and Development Goal 19, patient safety in what regards to the use of antimicrobials. However, the event does also tackle many of our secondary development goals, such as specialist development, for example, development of pharmacists in AMR, leadership development, as FIP believes that pharmacists can not only contribute to AMR, but they can be leaders on this as well. Integrated services, because we will focus on collaboration, as well as other development goals, as you can see on the slide, such as development goal 8, 11, 13, 14, 15, and 18. I would like also to invite you to learn about the recent declaration on AMR, which FIP was proud to sign in the recent Congress in Copenhagen that was held end of August and beginning of December 2025. During this declaration, or during that meeting for FIP declaration on AMR, about 80 or over 80 member organizations from different countries have signed a commitment for the role of the pharmacist in leading effects towards mitigating antimicrobial resistance, the importance of partnership, the importance of education and empowerment of pharmacists, the importance of having a robust and well-controlled medicine supply that includes different antimicrobial agents, and also the research to generate evidence on AMR and the important interventions as well as the important impact. If you would like to know more about this declaration, we invite you to read about the event on the FIP website, and also to watch the AMR legacy video that was captured during the Congress in Copenhagen. So by scanning this barcode, this QR code, you will be able to access our information related to the Copenhagen Declaration on AMR. Another important deliverable that FIP has worked on is in a recent FIP report on antimicrobial stewardship programs in hospital settings. As a member of the FIP AMR Commission, I have been privileged to participate in the writing and the conclusion of this report. This report overviews the current antimicrobial stewardship programs on institutional basis from all 6 WHO regions, and also highlights the finding of a big survey done on pharmacists in order to tackle the different resources and needs regarding AMR and AMS training. If you would like to access the report, you can find it at this on the publications website, and also you can scan this QR code to have full access to the document that is very recent and very temporary of the different efforts in antimicrobial stewardship. Now, this being said, I would like to move on to our first speaker, Mr. Greg Perry. Greg is the Director General of the Global Self-Care Federation in Switzerland, and Greg is going to share with us his insights over reducing infection burden and limiting antibiotic misuse. Welcome, Greg. The floor is yours. Please go ahead.
Thank you very much. Well, first of all, I just like to thank everyone at FIP, and Catherine in her absence, I think, but also to Catherine. And I just want to say how important we view working together with FIP as very important. We recently had a board meeting where FIP was identified as probably our most important principal stakeholder to work with. So this, I hope, is one of several examples of where we move forward working together as pharmacists and as the global self-care industry in a whole series of issues around global health. But of course, this issue of AMR, which follows the World AMR Awareness Week, is probably one of the most critical that faces global health. Not as though there's a large number of critical issues, but I think the fact that the principal impact of not dealing with antimicrobial resistance is very significant to humankind. And it's one where joint efforts like ours, as well as other people's, will be pretty critical. So next slide, please. So for those of you who don't know who Global Self-Care Federation is, let me just take a few minutes there. We represent those associations and manufacturers in the self-care industry, working closely with members and stakeholders to make evidence-based self-care solutions available to people. And within the context of AMR, we advocate for the responsible use of non-prescription antimicrobials and to support the global AMR strategies in line with the World Health Organization's goal. As of 2025, kicking off this year, we became members of the AMR Industry Alliance, which gathers actors committed to tackling AMR in the industry field. And we also became a participant in the AMR multi-stakeholder partnership platform. And this is facilitated by the UN Quad organizations to provide a One Health response to AMR. And indeed, it is a One Health response that we do need in AMR, covering all areas of activities, including from agriculture to humankind. So, and that also, I think, is a One Health response also requires, I think, a multi-stakeholder approach. Next slide, please. We do want to raise just at one point here, because it has become confusing. We are concerned about the consequences of the endorsement of a political election on AMR on proposed increased regulation of non-prescription antimicrobials to reduce the burden of AMR. Now, I'll come into more details about this, but I think what is important is to distinguish between non-prescription antimicrobials, which are evidence-based and are non-prescription by its as it's mean, as opposed to the incorrect use or even the illegal use of prescription antibiotics being sold over the counter. These are two very different issues, and they're often confused by the way in which certain documents such as these recommendations are operated. So we do want, just right up front, to make a very clear distinction between legitimate non-prescription antimicrobials, which I'm going to come to, on the one hand, and the incorrect use of antibiotics as an over-the-counter product, which are, of course, prescription products being used incorrectly over the counter. And it's that use of the word OTC, which I think becomes confusing to a lot of people. Next slide, please. Now, prevention. Well, the first thing I want to say about prevention in general is how this has now become a key focus point in all areas of global and increasingly national policy in health. Prevention is now seen, and of course this has been very much pushed and realized as a result of COVID, as the first thing that we need to do in public health. And it is interesting how I have seen, being based in Geneva now for over 10 years, I've seen quite a significant move from focusing on treatment, then looking more at diagnosis, and now looking at prevention. And prevention is obviously the key here also in AMR. I won't go into too much detail on this because this may be well known from other areas. But if we look at pillar 1 on prevention, universal access to wash and waste management to mitigate AMR is a key point. And this WASH is a WHO initiative. But I think important things here in mitigating AMR is looking, for example, at basic activities, and we're going to come to that, around hand washing and prevention, and our industry provides interventions around that, together with access to vaccines and expanded immunizations to manage AMR. Other issues as we go across on pillar 2 is access to essential health services, as I mentioned before, AMI diagnosis, and an uninterrupted supply of quality assured essential antimicrobials and health products for AMR, timely and accurate diagnosis, good quality laboratory systems and diagnostic stewardship to ensure clinical bacteriological and mycological testing. And then finally, pillar 4, appropriate quality assured treatment, up-to-date evidence-based treatment guidelines and programs for antimicrobial stewardship are key, and regulation to restrict the sales of non-prescription antimicrobials as well, and particularly the misuse of prescription drugs as OTCs. Next slide, please. So let me come to the point of which I was mentioning before, the use of non-prescription antimicrobials. And I think you can get more information if you wanted to screen in on the metrics barcode, which is at the top right-hand corner there. So this is where I was trying to make this distinction between the misuse of over-the-counter of prescription antibiotics to what I'm talking here, which many of you will know as pharmacists, which are available in the pharmacy. And these non-prescription antimicrobials are effective for managing what is essentially at the time a minor infection and preventing these minor infections from escalating into more severe conditions. So I think this is one of the key points here. If we look at sort of prevention as secondary prevention, there is a small minor ailment. It's unpleasant. It's not a nice condition, but it can be treated very effectively and very accessibly by way of going to the pharmacist and getting these products. And by applying these, which are simple to apply, we can prevent the spread of infections to something much more severe and which would actually probably require antibiotic intervention. So what are we looking at? We're looking at conditions such as minor bacterial infections, viral infections, fungal infections, parasitic infections, and certain general infection prevention. All of this, of course, as pharmacists, you will be aware of. If I can go to the next slide, please. Now, again, the code, if you look into it, takes you to one of our information papers on this. Now, these non-prescription antimicrobials, these include a broad range of non-prescription products, such as antivirals, antifungals, antiseptics, topical antibiotics, antiparasitics, and personal use soaps and disinfectants. So from the very beginning of trying to prevent any form of bacterial spread, the importance of using disinfectants and soaps is pretty important. But then we can go into looking at other activities which I've mentioned here. Now, I won't go into full details of these. Many of these, as you know, as pharmacists, you'll be aware of. But I think it demonstrates what is a very broad range of non-prescription products, which are, as I said, very simple to use and highly effective and very accessible through pharmacies. And this prevents, and I'm repeating this on purpose, it prevents the spread of infections, which later would require a a trip to the doctor and the use of an antibiotic. So what by having easy access to these products does? It does two things. On the one hand, it enables an individual to prevent a spread of an infection far worse than it needs to be. And secondly, it prevents the pressure, the continuous pressure on our health systems by ending up going to the physician. And the third thing it does, of course, is prevent the need for the use of antibiotics. And that, of course, is one of the main interests and objectives that we have in dealing with AMR, is to reduce the use of antibiotics as to where they are essential and not where they're non-essential. So this NPA is really critical. This NPA strategy is really critical in three specific areas. I'll repeat them again. Personal use, preventing people from having to have a spread of an infection, reducing pressure on the health systems, and particularly for doctors, and thirdly, in the overall strategy in dealing with prevention of the spread of AMR. Next slide, please. So here is the link between ourselves and between yourselves as pharmacists. Pharmacists, as we know, worldwide deliver easily accessible and trusted healthcare advice and are very well positioned to promote the responsible and rational use of antimicrobials through health literacy campaigns, but through the presence in the pharmacists. So as pharmacists, an individual comes to you, they have an infection, you are trained and understand what these infections are. You can make these minimal diagnosis, and you can help instruct the individual in the application of the treatment. These are obviously important in all areas of the globe. In low-income settings with a significant access barriers to health, I think community pharmacists play a crucial role in educating individuals. But I think it's also important to emphasize that even in the developed countries now, with the increasing pressures that we're having on the health services, that role, I think, is as much relevant in a developed country setting as it is in a low-income setting, though it may be more crucial in the low-income settings as it is. Next slide, please. So again, I'm sort of re-emphasizing the points that I mentioned before, but I think that combination of the role of the pharmacist, on the one hand, together with the availability of the non-prescription antimicrobials, radically and dramatically reinforces what we're trying to do in the various areas, reducing pressure, saving resources, and champion the role of communities and the empowerment of the individual. Next slide, please. Okay, so I've summarized a number of issues there. I'm happy to take these up further in the question and answer session. I do encourage you, I hope it works, to be able to look at more information that we have available to yourselves and to the general public by use of that barcode there. Looking forward to listening to the next presenters and to contributing to the question and answer session. Thank you.
Thank you so much, Greg, for highlighting the role of the pharmacist and the importance of correct use of non-prescription antimicrobials. And you have reminded us of lots of them, as you said, which are easily available through pharmacies. It is a pleasure now to move to our next speaker, Ms. Jane Seema. Jane is the Senior Regulatory Affairs and Safety Associate at Reckitt Pharmaceuticals, and she is speaking to us today from South Africa. Welcome, Jane. She's going to discuss the ensuring quality non-prescription antimicrobials and driving public awareness. Jane, thank you for joining us. Please go ahead.
Thank you very much, Dalal, and good afternoon to all the colleagues. My name is Jane Siema. As Dalal has mentioned, the Senior Regulatory Affairs and Safety Associate at Reckitt Benckiser. Firstly, let me take the opportunity to thank the Global Self-Care Federation and the International Pharmaceutical Federation for the invitation to speak in this webinar. Today, I'll be talking about how ensuring the quality of non-prescription antimicrobial products coupled with strong public awareness can help us combat the growing threat of antimicrobial resistance. First of all, I want to start with the purpose of Reckitt. Our purpose as Reckitt is to protect, heal, nurture in the relentless pursuit of a cleaner, healthier world. So what this means is that, we are making products that improve everyday health and hygiene, thereby ensuring access to hygiene, health, and nutrition for all, and supporting families and communities to live healthier lives. And our fight, our fight is to make access to the highest quality hygiene, wellness, and nourishment a right and not a privilege, because this is what inspires and motivates us. So what this means is that we are fighting infectious diseases through hygiene and education by reducing prevalent illnesses with trusted health products and championing public health issues, including antimicrobial resistance, and advocating for behavior change that improves community health. Next slide, please. So non-prescription antimicrobials. What is non-prescription antimicrobials? When we speak about non-prescription antimicrobials, we are referring to products that kill or control germs and can be bought without a doctor's prescription. I like that my previous speaker also touched a bit on this. So this includes products like antiseptics, disinfectants, sanitizers, throat lozenges containing antimicrobial agents, and over-the-counter medicines used for minor infections. These help people manage symptoms early and responsibly, but only if they are of good quality and used correctly. So those are the key phrases there: good quality and used correctly. Unfortunately, in many markets, poor quality or falsified antimicrobial products are still common, and these products may contain too little of the active ingredients or none at all. When microbes are exposed to substandard doses, they don't die, they become stronger and resistant. This creates superbugs that antibiotics can no longer kill. So ensuring quality is not a technical exercise, it's a public health emergency. Next slide, please. What ensuring quality means. So ensuring quality means compliance throughout the product life cycle. Reckitt is known for premium or good quality products, and some of the ways in which quality is ensured include strict manufacturing controls, proper labeling responsible marketing, and strong post-market surveillance. Regulators, manufacturers, pharmacists, and consumers must all play a role. Quality non-prescription antimicrobials can prevent unnecessary antibiotics use. For example, a sore throat caused by a virus does not need an antibiotic, does not always need an antibiotic. Yet some people expect antibiotics for every sore throat. Providing evidence-based symptomatic relief products like ibuprofen lozenges, for example, can help manage pain and inflammation without antibiotics. This reduces pressure on the healthcare system and protects antibiotic effectiveness. Next slide, please. Public awareness gap. So now there's a public awareness gap on the knowledge or education around, around antibiotics and antimicrobial resistance. Despite global campaigns, many people still misunderstand antibiotics. They believe antibiotics work for colds or flu, which or they may take them when they feel better, or they may stop taking them when they feel better. Sorry, this behavior fuels resistance. We must go beyond education. We need behavior change, helping people make correct decisions at the moment they choose the treatment. Next slide, please. So behavior change starts with awareness. There are many aspects to behavior change, but awareness is one of the foundations of it. All sectors can be involved in different public awareness programs, and these must be practical and accessible. So on my slide here, I'm just going to have a look at this. I just want to share some public awareness initiatives that Reckitt is involved in the hope that this will encourage different sectors to also get involved, and that this will induce some innovative ideas on other initiatives to raise awareness on antimicrobial resistance, right? The first one that I want to talk about is training of healthcare professionals so that they can confidently guide patients. Through the CPD website, Reckitt educates prescribers on antimicrobial resistance using the GRIP campaign initiated by Reckitt. And also medical detailing, emails, newsletters are also used to inform and educate healthcare professionals. This is done across different ways, including digital platforms. The next one is community and school-based hygiene programs. Reckitt drives hand hygiene programs at schools, taking advantage of the World Health Organization's World Hygiene Day. And Reckitt also does new mothers programs that educates new mothers on hygiene practices to protect their children. Reckitt does sexual health and well-being education programs to combat sexually transmitted infections, and also does community sanitation education program. Reckitt Global Social Impact programs on hand hygiene, and New Mothers program, sexual well-being sanitation programs in the year 2024 was done in over 56 countries, and 424 million people were informed with health and hygiene messaging, 40 million people engaged in our impact programs, and 9.5 million people were impacted. So partnership is also important. By partnership, I'm referring to both collaborations and different kinds of partnerships from different kinds of sectors. So Reckitt collaborates and aligns with government missions such as government departments in Mexico, Colombia, and other countries still counting. Also, Reckitt also collaborates with key opinion leaders, foreign affairs ministries, and academic experts to fight antimicrobial resistance, and aligns with the World Health Organization's One Health approach to antimicrobial resistance. Another way of picking an initiative on antimicrobial resistance would be clear product labels and simple usage instructions, also making a significant difference because it helps to educate the user or the consumer. Reckitt ensures compliance to regulatory labeling requirements so that it's easier for consumers to use the products correctly. So all in all, industry has a unique role. Companies need to invest in high quality products, evidence-based claims, and responsible communication. When industry drives awareness campaigns, supports professionals training, and invest in research, we move from talking about antimicrobial resistance to actively preventing it. Next slide, please. So what is the goal here? How will we know if we have succeeded or made progress in this fight against antimicrobial resistance? This will be when fewer antibiotics are prescribed unnecessarily, when consumers trust and use high-quality self-care options, and when antimicrobial messages are consistent across sectors, when regulators enforce strong standards, and when the public exercises more responsible self-care behaviors. So ultimately, success means preserving antibiotics for future generations so that they can also be still effective and usable for them. Thank you very much.
Thank you very much, Jane, for your presentation and for reminding us of the importance of collaboration and partnerships in tackling AMR. That was really helpful. It is a pleasure now to move to our third speaker. So last but not least, we are happy to welcome Edwin with us. Mr. Edwin Panford-Cuyano is the technical advisor at the Commonwealth Pharmacists Association in the United Kingdom and Ghana. And Edwin, over the next maybe 15 or 20 minutes, is going to address advancing awareness and responsible antimicrobial use. Edwin, we are so happy to have you on board. Please go ahead. The floor is yours.
Good morning, good afternoon, and good evening, everyone. And thank you, Greg, for your presentation earlier, and definitely Jane for yours as well. That as it leads nicely into mine. My name is Edwin Panford-Cuyano, technical advisor for the Commonwealth Pharmacists Association, based currently in the UK, but I'm registered pharmacist both in the UK and in Ghana. And my role within CPA is to look at all things AMR related. And the CPA's role is to essentially to advance public health benefits by collaboration, as well as looking at health system strengthening. So to set the stage, first and foremost, similar to what Jane said previously, awareness is the foundation for behavior, and that drives responsible antimicrobial use. But as well as trying to understand that, we need to look at, what the system must do, as well as once we've got that in focus, and once we've got that in place, look at what people, and that means professionals and the public, must do and also understand. Next slide, please. Awareness influences public behavior and consumer demand. It also, without fail, lots of evidence to show that shapes professional decision-making. It reduces unnecessary antimicrobial exposure and obviously supports safe, effective self-care, similar to what Greg had said earlier. But more importantly, strengthens stewardship and health system resilience. And one of the things that we saw this do very well is during COVID, how stewardship became strained as a result of the health systems that it faced. And without awareness, even the best policies are likely to fail. Next slide, please. So responsible use is not just about prescribing. It's actually about the decision-making at pretty much every single level that we can think of. So from a public perspective, we need to understand when antimicrobial products are appropriate. So, are there alternatives? And my previous two speakers have kind of shone a light on that as well. The using of non-prescription antimicrobials safely, because even those can still be abused, even though they're non-prescription. So the safety aspect still applies to them. Avoiding unnecessary antimicrobial use, knowing when to seek professional help. And for the health professional, reinforcing evidence-based durations. So make sure that we are up to date with, what is the current situation with this medication, with this drug. Communicating risk clearly in the language that the members of the public can understand. And we need to guide them with self-care in a safe manner, but also looking at their condition and making sure that it is something that they can sustain or maintain. And then also supporting them with non-prescription antimicrobial stewardship. So not necessarily using non-prescription, but is there an alternative to the non-prescription use as well? Next slide, please. So one of the things that is kind of thematic throughout this talk is that awareness leads to understanding, leads to motivation, and then the action. So one thing we need is an effective AMR communication. Now, behavior change relies on culturally embedded communication, but AMR is global. So we need to make sure that when we're communicating, we look at the context within which that we're doing this communication, and is it effective enough? You know, research has shown that members of the public still don't know what AMR is. And similarly, even some healthcare professionals can't even articulate what AMR or actually put into context what stewardship really means for them. So the communication that leads to that behavior change needs to be effective. It needs to be simple, actionable. It needs to address common misconceptions. So get to understand what the person in front of you knows about the condition and the drug treatment, and basically address any misconception. Provide alternatives. So if it's a viral, for example, what do they do instead? Just don't use these antimicrobials just like that and leave them to it, because otherwise they will revert back to, you know, what they know, which might be wrong. Also use trusted messengers. And as pharmacists, Greg and Jane have said that previously in their messaging, we are at the forefront. We are trusted. We are in communities. So we need to make sure that, you know, we are the trusted messengers that people can come to all the time. And we also need to be culturally adaptable across all regions. Now, we've got pharmacists from all over the world on this call. So make sure that your communication is to your public, wherever your setting is, that they can understand and appreciate the language. Next slide, please. So moving on to the role of pharmacists in advancing awareness. Positioning pharmacists as global AMR awareness leaders is a no-brainer. Basically, there are so many factors for the global pharmacy workforce. We're the most accessible health professional worldwide. Key advisors for non-prescription antimicrobials. We are essential to the triaging role, and COVID definitely showed that, you know, what we can do if we put our mind to it as well. We're educators in infection prevention and self-care, trusted sources for misinformation, rich environment, with, you know, the access of online material. Sometimes people do need that human touch, and that's where we come in, or even direct them to the right websites or online material for them to gain that information as and when they need to. And also, we are central to AMR campaigns in our community, and we should be central to that moving forward. For every AMR campaign in our communities, we should be at the forefront, either being there in person or guiding how that campaign is run and executed. Next slide, please. So if we're leveraging self-care to strengthen responsible use, what does that mean? Self-care is essentially vital for reducing unnecessary antimicrobial use. And several studies have shown medical pluralism, where people are using multiple things to essentially deal with the same condition. Now, some of them may not even be thinking about interaction with other drugs that they may be taking, interaction with herbal medication. Despite the misconception that there is no interaction, we do know that there are some herbal drugs that will interact with other medication that they may be on. So all of these things come into play, and pharmacists are key for that messaging to help self-care be done appropriately. So, you know, we're managing minor infection appropriately. And like Greg said, the creams, ointments might be more appropriate than actually going down the oral route, reducing unnecessary antibiotic demand, encouraging adherence to the product and correct product use. So, give them the right time or the length of time to use it. And if it's not working, come back and see me, for example. It's a good messaging. It shows not just showing care, but it also shows that we can actually be there for them to guide them appropriately and know when it's not working, how to switch to something else. We're there to empower our communities with reliable knowledge, and that ultimately will drive to better self-care and responsible antimicrobial use. And ultimately what we're doing is supporting system resilience. So we start small, but just that what we do within our communities has got implications for health system strengthening widely, because the information we pass on to members of the public will then be replicated. They will tell their friends, family, and that messaging will replicate. And so will the bad messaging as well. So the good ones will replicate, and so will the bad ones. So we always need to make sure that we are there giving them reliable knowledge. Next slide, please. So pharmacists as key healthcare workforce in this AMR awareness and infection prevention message, we need to be leading awareness campaigns, and not just World Antimicrobial Awareness Week. We need to be doing that throughout the year. Yes, use WOW Week, the WOW Week as a good platform to engage, but we need to do more throughout the whole week. Take your community. What are the main things, that are kind of problematic within certain seasons, and raise awareness on those things. If there's a cholera outbreak, for example, you can play a role. We need to collaborate with consumer health industry. So, as seen here today, you've got industry and you've got GSCF here as well. So these collaborations strengthen the messaging beyond just the pharmacy wall. It goes to all the key players, and more of these collaborations are absolutely needed. Digital and community engagement strategy. Most people have some kind of smartphone or access to a smartphone somewhere now. So we need to make sure that we are utilizing those platforms to engage with our community and give them the right platforms to go to for the messages. Everything we say needs to be evidence-based and needs to be up to date. In pharmacy education moments needs to be, capitalized on. Once you've got that person in front of you, one thing you might say might have an implication for them for the rest of their lives. So make sure that we capitalize on those moments and leverage those interactions with our patients or clients. Social media needs to be aligned with global AMR initiatives, and partnership needs to go as far as schools and local leaders as well. If we tackle these education strategies at a very young age, it would lead to behavior change that will be sustained throughout their whole lives. And that is a very good point to start some of these messaging as well. Next slide, please. So obviously there are the structural inequalities, there are economic constraints, there are cultural expectations and diagnostic ambiguity when it comes to the global challenges in awareness. But what still needs addressing, health literacy gaps. We still know that people still do not see that antibiotics cannot be used in viral infections. Can they even read the information leaflet that you're giving them, for example? Because most of them come in English. Can they read it? Maybe not. So these needs to be addressed within the local context. What are the cultural expectations that are driving antibiotic demand within your setting? Can these be addressed at a very early age, for example, or within settings that the messaging will spread much quickly and much better? Variations in regulation and over-the-counter access is also another challenge, because what's a prescription only in one country might not necessarily be a prescription only in another. But similarly, what's prescription only and treated as that might be prescription only in one setting, but not treated as that. So all of those still present challenges for us. Misinformation around antimicrobial usage, limited visibility of AMR as a community issue. Now, we talk about it as a global issue, but let's start at the community issue. You know, I walk into a pharmacy, for example, and I look for posters to say, you know, use antibiotics properly, do not use until. Those are visible things that people probably resonate with and not see it as a global issue. But whatever is done locally has definitely got global implications. Diagnostic stewardship, I'm a very good advocate for that. I think most pharmacies should have some kind of diagnostic stewardship ability in the not so distant future, or given the opportunity to actually direct someone to get the diagnostics done so we can support them with their treatment once they come into us. A global pharmacy voice needs to be harmonized, and we need to all speak from the same messaging. Next slide, please. So what are the practical steps forward? Strengthen the public-facing self-care guidance, ensure clear, responsible messaging for non-prescription products, align global AMR campaigns with pharmacists as primary educators. Misinformation around antimicrobials, we need to be first aware of what those are and then know how to address them. Train early career professionals in communication and behavior change, especially around AMS. Now, they, I mean, as a pharmacist, we probably come out knowing about how resistance happens and all of those things. But what does that practically mean once I am in the community pharmacy, for example, or hospital pharmacy? What does that practically mean for me as an early career pharmacist? As time goes on, obviously, we develop means and ways of dealing with communication and behavior change. But early career pharmacy professionals needs to be, and most importantly, embed AMR awareness in every community care touch point. So know your locality. Is there an event going on that pharmacy or your pharmacy can be part of, or you as a pharmacist can be part of, to raise awareness about the inappropriate use of antimicrobials? Last slide, next slide, please. So my last slide before I go is empower communities with accurate, actionable information. So not just saying this, don't use this, but use this instead. Give them things that they can action within their means as well. If the person cannot afford something, are there alternatives that they can afford within their means? We need to support responsible antimicrobial behaviors, leverage pharmacist accessibility and expertise. We are in communities, we are trusted, but do we actually take every opportunity to enhance that profile that we have? We also need to build unified cross-sector AMR messaging. So we need to work with industry players, NGOs, all of those people within our community that help get the messaging out. We need to collaborate with them. And also champion evidence-based use of antimicrobial products, such as the use of diagnostics to then inform why we're making certain decisions. Patients love it when we can tell them, right, do not use this product because this is the evidence to show that what you have is viral or non-viral or is self-limiting. So those evidence-based will strengthen our messaging and our profile within the setting. And first, finally, from me, awareness is the bridge between insight and action. And you've got the public, the professional, and then the system to play with. Final slide. Thank you very much, and looking forward to the Q&A.
Thank you very much, Edwin. That was really a nice reminder of the systems thinking, and also a great tap into the role of pharmacists in AMR. So I'd like to thank you for that. And I'd like to thank again all our speakers. We will move now to the Q&A session. And I will start with a question we have in the Q&A box. Please, I would like to encourage any one of the attendees who would like to ask any questions to just type them in the Q&A box, and we will address them to our speakers. So the question we have now is, how should clinical pharmacists prescribe antibiotics? Should they be from narrow spectrum to broad spectrum or other method? I'm not sure if any one of our speakers would like to take this question.
I will go first. So I think let's take the first part of the question, how clinical pharmacists should prescribe antibiotics. The first thing is diagnosis. You know, what are you treating? Understand, so get the lab results, get some kind of an idea of what you are actually treating. Majority of the time, we treat empirically based on symptoms, and then we find out that actually this is not the case. So wherever possible, let's start with the diagnosis to say, right, this is what we have, and therefore treat appropriately according to the guidelines. And that goes back to my messaging about make sure that it's evidence-based. So what does the current guidelines say about treating such a case? And how, you know, do we have the, and then it comes into the whole issue of access and what you have, the products that you have. But first and foremost for me is diagnosis. What are we treating?
Thank you, Edwin. Any one of our speakers would like to pick a little bit into that? Okay. So, I would like to, I will check if we have other questions for now. So, okay, maybe I can go forward and ask our speakers a couple of questions in the remaining time we have. We have a question now in the chat. So what future perspective of the world to tackle AMR challenges? Is it to work on development of new antibiotics or to focus on old ones? Anyone would like to take that question about new antimicrobial development?
I'll go again. Well, it's both. It's not one or the other, because what we need to understand is even if new antibiotics are developed now, the resistance will happen in the future. It's a pattern that's been seen over and over again. So we just can't focus on the new antibiotics. We need to focus on preserving what we have whilst developing new ones, but also how do we preserve the new ones that come on board? So it's not one or the other. It's actually both. Yeah.
So it is our effort to preserve those precious chemicals, right, Greg?
Exactly. Absolutely.
As much as we know that the antibiotic pipeline have been dry for the last couple of years, and maybe the development of antimicrobials is among the least developments we see in pharmaceutical products overall, because of many challenges like the cost and, as you said, the emergence of resistance. So maybe we will not go one way rather than the other, but maybe it is the fact that we need to preserve those chemicals against resistance, which like maybe one of our speakers said, like if that antibiotic does not kill the microbe, it renders it stronger.
Yes.
So resistance will happen. I don't know if Greg or Jane do have any comments to add on that.
I'll be very quick. I hope people can hear me because I have a bad reception.
Yes, we can hear you, Greg. Go ahead, please.
Endorse what Edwin said. Right. No, it's not one or the other. In fact, there is an organization in Geneva called GARD-P, which is looking at repurposing of, let's call it, or existing anti. I think an interesting initiative as well, looking at the development of antibiotics. The problem with antibiotics from a commercial point of view is that they should be limited in use. So that's a sort of like a problem in the sense of limited use. But I think it is of both, yeah. And I think that's new antibiotics, repurposing and reusing old antibiotics. But at the same time, very important is the whole issue of appropriate use as well, that forms. Happy to speak to a little bit more, but that wasn't the question, but just endorsing what Edward said.
Yeah, thank you so much, Greg. Like that idea of repurposing is also being used in pharmacy across many sectors, including the antimicrobial use. But Greg, before you, since you are still with us and before your connection challenges like happen again, may I please ask you a little bit about the role of global organizations? For example, you come from the Global Self-Care Federation. So can you please like tell us more about the role of your organization, the role that FIP maybe can play in harmonizing the messages towards antimicrobial resistance awareness, and also to promote the action, like as a federation, how can you promote and coordinate action among different countries?
Hear me?
Yes, we can hear you and we can see you, Greg.
Someone actually suggested. Okay, someone suggested in the chat. I'll see if it works. I might turn off my
your camera
video if I need to. I think our role very much, and working together, is very much about communication. And on the one hand is communication, I think on the other hand is advocacy. But if I aspect, and it's about building up this awareness. I think working together globally in making of actions that need to be taken place and solve the issue. I think a lot has been done, but I think that's in more of the on the ground issues. But I think also coordinating and having that single voice is very important. So I think that's one of the clear roles. The second thing, advocacy, and that is working with the various stakeholders and the various actors. Obviously, principally is the organization, but also I think it's also ensuring that at those platforms internationally that we can advocate the specific issues that we've been talking about. And just talking globally, I think. And it has real global implications because AMR doesn't have any boundaries, yeah? But a lot of the actions are local. It's that classic think global, act locally. And they've been mentioned here. I don't have to repeat them too much, but it is a community issue. It is I know on the African continent, I mean, it isn't 5 established languages. There are a lot of national and local languages where, as pharmacists, community pharmacists, the role is everything's digital. It's going to be in French or whatever. We got to think digital locally and local languages as well. And I think the other part of being a global organization, again, implications, but we've got to advocate that a lot of the actions we're talking about are, again, on the ground, small, and it's to do with self-care. It's about washing and sanitation, working with your pharmacist to know about use, yeah, whether that's an antimicrobial or whether it's an antibiotic. And the other thing, of course, very important, is responsible disposal. So, not throwing the antibiotic
I think I cannot hear Greg anymore.
Yes, maybe Greg, you can close your camera. It may work.
It can be done, which is such, which we were talking about, but there is so much which can be done at level, community level, the family level, and the individual level. Washing, appropriate use, responsible disposal. I think that's what we got to get across as global organizations.
Thank you, Greg. Like there was a bit of technical cuts while you were speaking, but we were able to capture your main themes of advocacy, collaboration, looking at the cultural differences while we advise towards correct use of antibiotics, and also the role of different organizations, the pharmacists, the community, and maybe people as well. So thank you, Greg, for that. I have a question in the chat about the education. So one of our participants is asking, like, whenever new antibiotics are developed, they are used blindly. So the user, at the user end, there is a blind, maybe a knowledge about antibiotics. And this blindness at the level of the end user will create challenges. And this will issue in the development of resistance. So the question is, what is the right way of educating patients about antibiotics? Like maybe this was addressed in many of the bits and pieces of our speakers, but like, can we give a clear message about how education can be right and useful?
Yeah, I can take this one. So a bit of what Edwin said, it's not really about new antimicrobials that are being developed or old ones. You know, antibiotics are antibiotics. So education can happen in different ways, because remember, education is for people of different sectors, different cultures, and different environments as well. You know, we have to make sure that we tap into all of these different areas when trying to educate and raise awareness. This would include digital platforms, social and community programs that we do. So education can be done in different ways. I mean, there are others also that are not necessarily educated in that way. For example, in other third world countries, where maybe the education level is not that well. The health education, as Edwin was saying, may not be that strong in different kinds of countries, even including first world countries. But there's a way to reach those people. You know, using digital platforms, you can reach those people. In communities, we can reach those people. So we have to make sure that we tap into different kinds of sectors, different kinds of ways to reach people and educate them.
Thank you, Jane. Thank you so much. We have another question about vaccines. So the question says, we are experiencing global antimicrobial resistance. Are there researches ongoing to discover vaccines? I would rather say there are not really vaccines against AMR, but the correct vaccination schedules and the intake of vaccines is one of the measures we advocate towards reducing AMR. I don't know if any one of our speakers would like to talk a little bit more about this and the importance of vaccination, like as a part of self-care.
Can you hear me?
Yes.
You can hear me?
Yeah, we can hear you, Greg.
Okay, I think I'll be very quick. I think looking at it directly, I think the importance of the vaccination is prevention. So if we're looking at of various diseases, by vaccination is probably one of the biggest pillars for prevention, with activities around self-care. So, and I won't go into the various aspects of self-care, the basic actually of sanitation, hand washing, or whatever. These are all part of prevention. But where the vaccination becomes interesting is by people being vaccinated, they won't fall into other illnesses. And if they don't fall into other illnesses, they may not get secondary illnesses either, which may require an antibiotic. Or they will be prescribed an antibiotic when maybe they don't need an antibiotic. antibiotic, but they'll be suffering from a secondary illness that may be developed from that. So I think that the aspect of the vaccination is not so much a vaccination against AMR. I think it's more, from how I see it, is a vaccination that prevent other diseases which can have secondary effects, which can the need for antibiotic use. So if we have more vaccination and we have more, that way also a more of antibiotics.
Okay, thank you.
But there's one thing I just want to pick up very quickly, which I think which the pharmacist has a very special role, and it was mentioned. As a pharmacist, you will know often the person who comes into your pharmacy, doctor will, and you may well know what other medicines they're taking, and therefore you could be able to advise on, negative interactions between various products that are being used, including the use of an antibiotic or not.
Okay, so again, the role of the pharmacist, and FIP has advocated for this, the role of the pharmacist not only in maybe educating the patients, but also the role of the pharmacist in being part of the multi-professional or interprofessional team, health team in optimizing the role of antibiotics, the role of pharmacists in research also in new antibiotic discovery and so on. So yes, and this was, I cannot emphasize it more as it was nicely deliberated by our speakers. One attendee is asking about the detrimental use of antimicrobials for a short time in minor ailments. So there is a widespread misconception that the OTC antibiotics for minor ailments can be used for short time. And the participant would like to know about the detrimental effect of this on AMR. So anyone would like to take that? Okay, so maybe our answer would be, like, from a pharmacist point of view, that the correct use, the correct dose, and the correct duration are advocated for antimicrobials, like they are for any other drug. The correct use and the evidence-based use of any antimicrobial, whether it is over the counter or prescription only, is our way to keep those antimicrobials active and avoid further development of resistance. There is one question
I'd
about...
be very quick there.
Yes, go ahead, please. Go ahead.
No,
please,
I was just going to say, because it's at the moment a minor ailment, and it doesn't mean you should be using it for a small period of time.
Correct.
If you're using these non-prescription applications, you should be using them for the period of which you're required to do, which is usually what the pharmacist will be telling you use this for 7 days. Yeah. When your condition gets better, don't full time. I think there's a very misconception with people on that. I think it was very good to have brought that up.
Yeah, so it doesn't mean if it's a minor ailment, then you are able to use the product for a short period. Whether minor or not minor, the product should be used for the recommended time, and this is important for avoiding further resistance development. Thank you, Greg.
Dalal, can I just add something to that as well?
Yes, please go ahead.
One of the things that community pharmacists especially can adopt is the delayed prescribing method. So where basically you give the patient, if the symptoms scream at you that this is viral, the chances are it's self-limiting, it will go away. So let's look at some other minor ailments without giving them the antibiotic or antimicrobial agent, but keep them in your system and say, right, I'll call you in a couple of days, see how you're doing. I'll call you in 3 days, 4, 5 days. Just keep that momentum going, or even just say, if it gets worse, come back and see me. Just give them that reassurance that you're there for them. Yeah. So that delay, it doesn't mean I'm not saying no, I'm just saying not now, potentially. And the chances are, it will probably get better if it's viral. But you've given them the reassurance that you're there for them.
So this is like I can count on this for two things, Edwin. It is the delayed prescription, like it is a wait and see approach for the patient. And it is also our role in keeping the patient informed that we are there for them in case symptoms get worse.
Absolutely.
So, and I guess this is the practice now in some countries where pharmacists are able to prescribe antibiotics for minor ailments such as urinary tract infections or such as strep sore throat. So they ask the patient to just wait and see and then come back so that they can prescribe the antibiotic after they have made sure that the ailment has persisted for a long time enough to judge, or the symptoms have persisted for a long time enough to judge that this is not a viral infection on behalf of the pharmacist. Yes. Yeah. So thank you very much for that, Greg. I would like to know something from Jane. Jane, you have showed us a very nice slide in which you entailed the role of the different sectors in combating AMR. Jane, coming from industry background, and you come from Reckitt, so what do you think there is a cross-sector collaboration or a partnership which is most important and is still missing for the sustainable partnerships and containment of AMR? Can you please tap a little bit into that?
Oh, you mean what's missing in the cross-sector collaborations?
Yeah.
Okay. All right. I think there's still a lot to be done in collaborations. I mean, given the fact that antimicrobial resistance, comes in from different directions, basically. It's human health, it's animal health, it's the agricultural sector, it's the environment as well. So this comes in from different directions. So basically, no single sector can actually successfully fight antimicrobial resistance. So all of this is required. What's required is collaboration from all of these different sectors, different areas of the environment as well. These are required to tackle this antimicrobial resistance. And when all of this comes together, that's how we get aligned policies, and data sharing in order for us to see how far we are in the progress and where there's support and more resources required. So when there's enough collaboration, we are able to monitor and see the progress and where everything is going. So collaboration is important in that it assists with also consistent information. There's the same information coming from the human health side, from the animal health side, from agriculture, from the environment, and policies also align. So there's policies that align with each other and they don't contradict with each other. And data sharing is also there as well.
Yeah, so I think, thank you, Jane. I think we are in an age of data and big data nowadays. So maybe data sharing among those different sectors would be key so that they all know the system and know how to approach it, each from their perspective for tackling AMR. Thank you so much, Jane. And I like that slide in which you tried to be comprehensive of whatever in the background lies, which can combat the different efforts against AMR. We have one question, or maybe that's a thought from one of the participants saying, I wish antibiotics in detail, I think that she means, or he means by prescription, would be available only in hospitals so that people would have only access to antibiotics in hospitals. I think we all would find it easier if antibiotics exist only in hospitals and can be given only upon hospital admission. And this would save us lots of resistance happening. However, this is not the case. Maybe we have to agree and to acknowledge that the use of antibiotics is widespread in hospitals and outside hospitals. And the key would be, like our speakers have mentioned, the key would be the care we take of the patient, the correct communication we do, the education of the patient for those antibiotics to be correctly used, and the ongoing efforts among health sectors and other sectors so that there is correct use of those medications, whether in institutional bases, in hospitals or outside. Any of our speakers would like to add anything on that, like regarding that question or that thought from the participant?
Yes, so two things. I think let me also add to the collaborators that we need for this. So I think for me, we need to now start looking outside the health and kind of social care environment. So let's bring in, you know, the media, for example. Communication on AMR and AMS is still very much not our strongest point. It's not getting there. So let's bring in the people that know how to get that messaging out. You know, filmmakers, let's get them to involve to actually make a good documentary, or, you know, capture patient narratives. AMR survivors, the WHO has got AMR survivors kind of approach going on. Let's capture their stories. You know, we now need to get to a stage where AMR is being personalized enough rather than an abstract concept that's happening in the lab somewhere. Unfortunately, we don't have a Greta Thunberg in our midst, so we need other ways of getting that messaging out one way or another. So going back to the hospital-only access, I mean, access is a huge issue. But if you live in a remote area where the nearest hospital is, you know, 2 hours drive, for example, that's not going to be. So yeah, as much as we would all, like you said, Dalal, as much as we would all love to, the practicality on the ground is that not everyone has got access to a hospital or a clinic when they need it. So we need to find ways of giving everyone equitable access to these precious commodities that we have, and the best ways to use it appropriately. And that appropriateness means, you know, what are we treating? Once we know what we're treating, there's the duration, use it as prescribed, and just kind of, educate and advocate for the safe use of what we currently have.
Yeah. Thank you, Edwin. I cannot agree more. And actually, I had a question in mind to ask you about what campaigns you think can support public health. So you have just mentioned social media, maybe, and antibiotic use survivors. So that was really like if we want to think outside the box and outside our traditional thoughts, maybe for me as a pharmacist and for you as a public health specialist and pharmacist. So if we want to think outside the box and say, like how can we make the problem of AMR and the correct use of antibiotics a person-centered issue or an individualized issue for patients? Like if we go to social media, if we go to maybe there are some trials also that are advocating the role of art and the role of literature and anthropology. There is lots of studies going on, for example, how can we make patients more aware by using their own language? Is there a language barrier or a cultural barrier that's preventing people from knowing well about AMR? So lots of things are going outside, and they do not look like the traditional efforts that healthcare providers try to make. So collaboration between health and those exterior maybe or different sectors would bring us to a different level when we talk about AMR. What do you think?
Definitely. And I think it was, you know, I was in a conversation this morning as well, and we're talking about actually let's bring in the financial institutions as well. One of the questions that I got asked in Ghana by a pharmacist, which is right, is, you know, what's the financial gain in me becoming a good steward? Now, I then had to think on my feet and say to him, you've got footfall, you know, you've got that trust, the patient will come back, and the fact that they're alive means that, but that's not been quantified as money.
Yeah.
You know, so we need to bring in all of these various players to actually enhance what stewardship can look like and should look like, and the benefits of actually doing it the right way. You know, I think I was watching a comedy the other day as well, and someone was mentioning antibiotic resistance in there. And as much as it was funny to me at that time, it actually, you know, those are moments where we need to, these little sitcoms, we need to bring in those messaging as well. Subtle, but obviously appropriately brought in.
Yeah.
And I think, it's going beyond just the clinical setting, beyond the community pharmacy. Let's go into the theater. If someone is writing something about an infection, can we subtly bring in the potential, just say, oh, I don't want a resistant case, for example. And I'm sure we all know people who are, film producers, writers, all of that. Let's reach out to them and explain what AMR is and how they can support this messaging. But our tentacles just need to go wide and far.
That's very interesting, Edwin. Like, you are going to those people and speaking in a language that is meaningful to them, so that you convey the message of how everyone can play their role in mitigating AMR. And that's like really very interesting. Thank you so much. I think maybe it's time now to conclude our webinar. So we will finish. Thank you again for all our speakers, and thank you for the participants who made this interactive. In order to close this, I will just tap a little bit on the themes covered by our speakers. So behavioral change, advocating for behavioral change in the use of non-prescription antimicrobials, also public awareness and the role of the pharmacist in maybe mitigating the public awareness gap, the role of education, the role of different sectors, like a systems approach in which the health sector, the community, consumers, industry, government, academia, schools as well can collaborate together and can communicate. Maybe with the rise of social media, also social media and digital platforms could support the fight against AMR. So the communication between those entities as a systems approach and looking at them in a One Health perspective would be really beneficial. Also, our speakers tackled the importance of self-care, making people empowered, making people aware of whatever they are going to use, the correctness or the importance of decision-making when it comes to the use of antimicrobials. Also prevention. Our speakers discussed prevention as the first pillar, and this was nicely interpreted in terms of if we have good prevention, if we properly use vaccines, if we properly use antibiotics as recommended, this would be crucial. And also, of course, the differentiation between the legitimate use of OTC antimicrobials and the different products discussed in our session versus the illegitimate use of antibiotics over the counter, which are not supported by evidence. So thank you again, everyone, and we invite you to look into those comments raised by our speakers during the session. This session, as well as all other digital events, can be accessed through events.fip.org. So if you would like to have a look back into the different events for World Antimicrobial Awareness Week or other FIP digital events, you are invited to visit them there. Next slide, please. This is an invitation to the 84th FIP World Congress of Pharmacy and Pharmaceutical Sciences in 2026, which will be held in Montreal, Canada. This is the theme of the Congress: One Health, One Pharmacy, Bridging Science, Practice, and Education. So we will invite you to our Congress and also to register. These are the sub-themes that are shown here. We have 3 sub-themes for integration, innovation, and collaboration. The closest date is 18 March if you would like to submit your abstracts to the conference. So please visit the conference website to be aware of the important dates. Next slide, please. So by this, we would like to finish our webinar. I hope the event was beneficial for everyone. Thank you again for the speakers and for FIP for organizing this, and wish to see you later in more informative and educational webinars. Thank you so much for attending.